Hello, my name is Jordan Jackson, and today I will be informing you on how to do a proper blood draw. When it comes to drawing blood, practice makes perfect. All right, we are going to begin. When you make contact with the patient, you want to announce yourself, tell them your name, your title, and what you intend on doing with them, because that matters. You want to establish a rapport with the patient. You want them to remember you. You may have to stick them again. Blood work is usually not a pleasant thing for a patient, especially in a hospital. It's done multiple times during their hospital stay, and it's painful. So if they know you're good, a lot of times they'll be happy to see you because they know you're good, or that you can get it that first time. You don't have to stick them multiple times to try to get their blood. So you definitely want to do that. You also want to identify the patient. You need to make sure you are sticking the correct patient. It is vital. You don't want to mix up tubes. You don't want to mix up labels, because the blood work determines how the doctor treats the patient. So you don't need to mix up blood work. That is very important. Now, the next thing you want to do is adjust your surroundings. You may need to make it brighter in the room. You want to be able to see as well as you can, because you don't want to miss a vein. You don't want to make it harder for yourself when it comes to trying to stick that person. So it needs to be bright in that room. You may need to adjust the bed. You may need to lift it or lower it depending on your height. You also need to be comfortable. You may have to get in a weird position. You may find a vein on the very back of the patient's arm, or very high up on the shoulder. You never know. So you want to adjust it to where you're comfortable, and also where the patient is comfortable. Next, you want to apply a tourniquet onto the arm that you're going to decide to check first. Here's a tourniquet. You're going to tie this tourniquet over the sleeve or gown, and you're going to tie it tight because you want those veins to pop up. A lot of elderly people, their veins aren't so great, so you need to tie that tourniquet tight. So the best thing to do is put it over the sleeve. It hurts less. Okay, so the next thing you're going to do, you're going to tie that tourniquet as high as possible. Once you've done that, you're going to look for a vein. Once you find that vein, you have to sanitize it. And that vein needs to be bouncy as well. It needs to be bouncy. If it's not, it's probably it could be a tendon or an artery or something like that. So once you found that vein, you need to wipe it with an alcohol pad as well as you can, and you want to insert the needle, a butterfly needle. This is a butterfly needle. This is a hub. You attach it to the butterfly needle. This is where you will insert your tubes once you have inserted the needle into the vein. All these tubes, these tests are for different things. You also have to make sure you have the correct tubes. You don't want to have to see the patient again over something so simple. Okay, so now you have inserted the needle. You have attached the hub. You have inserted the proper tubes that you need to run the test. Once you have done that, you need to fill those tubes up with as much blood as you can, because there could be extra tests down the line, and if you have enough blood, they can just run those tests off that blood that you got, because you got plenty, and you don't want to have to stick that patient again over something that you can avoid. All right, so once you fill those tubes up, you want to pull all those tubes out of this hub, because you're done now. You're going to activate a safety lock. You want to push a button. That needle is automatically going to retract into a little capsule to keep from sticking the patient again and sticking yourself. So once you make sure that that is good, you want to dispose of that needle. Always in hospital rooms, there is a sharps container. That needle always needs to go in that sharps container, because if you put it in the trash, someone can end up sticking themselves, and usually that would be someone like housekeeping who comes to get the trash, and you don't want that to happen. So you always want to put that in a sharps container. Everything else, you put it in a biohazard bag because it has been in contact with blood. Those cans are usually red, and you'll know it's a biohazard bag. They're always red. So once you have thrown everything away, you want to put that room back just how you found it. You want to lower that bed and you want to cut those lights off. Usually it's to the patient's liking. You should ask the patient how they want everything before you leave. Do they need anything before you leave? And make sure that that patient is good. Because even though you're just drawing blood, you are still a part of that healthcare setting, and you want to get that patient everything that they need before you go. And once you dispose of everything and you make sure the patient is good, that is it. You close the light and you turn off the light and you close the door. Thank you. That's it.